Well, good afternoon, and thank you very much for the invitation. We're at a very challenging time in the Irish healthcare system, and as you know from the papers, we have some challenging issues around resources. But notwithstanding that, out there today in every part of Ireland are a huge number of health professionals and a huge number of patients that are being treated. And it's very pleasing to note that in the main that the public, while they have concerns about the issues when accessing care, but when they access care, they're very well pleased at what they receive. However, we all recognise there is a clear need for health reform. Challenges are of a scale that raise questions about sustainability. We have significantly reducing budgets. We have high waiting lists and inequitable access to care. Our system has a lack of integration. There are capacity and management deficits. There are inadequate governance and financial systems. We have an ageing and changing population with increases in demand and expectations. And we have a growth in the incidence of chronic illness. So what the government have decided is to embark on a major health reform programme to deliver a single-tier health service supported by UHI, to deliver an integrated model of care that treats patients at the lowest levels of complexity, as close to home as possible, and to carry out major reforms to be introduced prior to UHI. The reforms will help to deliver on the overall objective of the health service, which is to improve the health and well-being of the people of Ireland by keeping people healthy, providing the healthcare people need, delivering high-quality services, and getting best value for health system resources, providing the healthcare people need, and delivering high-quality services, and getting best value from health system resources. So it is a major reform programme, and this government and this minister are quite determined to deliver it. And as Secretary-General of the Department of Health, myself and my colleague Tony O'Brien, who's the new Director-General Designate of the HSE, will be the principal supports to the Minister and the Ministers of State, Alex White, who's just been appointed, and Kathleen Lynch, who all have critical and important leadership roles. So I want to give you some examples of the tangible changes that patients will experience as a result of the reforms. We should see improved health and well-being, and people will take more responsibility for their own health and well-being. We'll have faster, more equitable access to hospital care. The government are determined to have free access to GP care. There'll be better management of chronic illness, and I commend the work of Dr. Barry White and his team. Barry is leaving the lead role at the chronic the development program that he's leading, the chronic illness agenda that he's been driving. He's leaving that reform program, but he will be available to my department, and he will be available to the minister to help in the years ahead. He will, of course, be replaced by another director. People will be treated in their own homes, and we will have improved quality and safety. Now I want to come to some issues around patient safety and quality. New frameworks for professional regulation have been developed. The Medical Council, the Pharmaceutical Society of Ireland, and more particularly the informal regulatory forum of CEOs of all of these regulators working together. I commend those organisations for coming together, and many of them have signed memorandums of understanding to facilitate a lot of joint working and to share the experience they have of dealing with some of the pressing issues related to patient safety. The whistleblower legislation is important. There have been significant developments in the clinical governance of our system. The national clinical programmes I've referred to are hugely important. The HSE Quality and Safety Directorate and the successful management of many patient safety incidents is also noted. I also want to compliment HIQA, who have recently, or in quarter 2 of 2012, they released standards for safer, better healthcare, and that will be monitored through Q2 of 2013. I want to pay a tribute to the chairperson of HIQA and to the chief executive for their work and their diligence in delivering these standards, which are the cornerstone of the future development of patient safety in the Irish health system. The establishment of a new patient safety agency on an administrative basis, the Minister has already flagged publicly. Now, this is an agency that will work in collaboration with all in the sector. It's not about a top-down approach, it's very much about a bottom-up approach. And we look forward to that patient safety agency being established in the last quarter of this year. Again, I want to commend Dr. Philip Crowley and Dr. Tony Houlihan for their work in this area, and I also want to thank HICWA for their cooperation in this matter. We also will be developing risk-based approaches to the provision of indemnity to services and professionals. That will be Q4 of 2013. And of course, licensing will initially focus on hospital and specialist services, and it's due to commence in 2015. So it's a bottom-up approach in collaboration with the regulators, and I want to, at this point, pay a particular tribute to the many patient advocacy groups with whom the system works, particularly those that have dedicated themselves over many years to the interests of the clients that they serve, and many of them have played significant, important roles in informing the department and informing ministers about what is the best solution from the point of view of the patient. The patients are the only priorities we have. In fact, we have only 4 priorities every morning: patients, 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 and patients. So health and well-being is also critical to what we do. The health sector needs the active support of other sectors to improve health and well-being, which are essential to the sustainable development and the economic and social interest of the country. In this regard, and I know this is also related because there are some issues here for frontline staff where they have to deal with the issues around the clinical issues that emerge from obesity, from alcohol abuse, and from tobacco. Still 29% of the population of this country smoking, and the alcohol problem that we really have has to be tackled. I'm very pleased to note that the Minister and Ministers of State are addressing some of these issues, and they are critical because, in fact, if we could control obesity and control the intake of alcohol and eliminate the use of tobacco, we'd have much safer services for those patients. And of course, there will be a health and well-being framework published at the end of 2012. Now, I just want to move on very briefly to take you over some of the key actions and to assure you that some progress has been made to date. The bill for the designation and substitution of interchangeable medicines has been introduced to the Oireachtas. The legislation to extend GP care without fees to all is on a phased basis has been proposed and presented. A new model of care delivery in primary care will be introduced in 2012 and 2015, and the new primary care fund will be established. In the acute hospitals, we want to deliver more responsive and equitable access to vital hospital services for all patients. And the Minister, you'll know, is particularly interested in the targets that he has set for emergency departments, for inpatients, for day cases, for diagnostics, and for outpatients. These targets do help people focus on quality and safety. And I want to thank all of the staff involved. For example, a 19.8% reduction in trolley waits from January to June versus the previous year. We are progressing the establishment on an administrative basis of the hospital groups, leading to the introduction of independent hospital trusts down the line. I want to commend Professor John Higgins and his work, and despite what you might read in the newspapers, I can assure you he hasn't finished his work yet and the Cabinet haven't seen it. So it's only pure speculation that's out there in the media. But this report will be delivered in a formal way following a Cabinet decision in due course. In relation to social and continuing care, the Fair Deal Nursing Home Support Scheme, the review of that has commenced. We've published the Disability VFM and Policy Review. Both of those are being led by Minister of State Kathleen Lynch, and they're excellent reports, and the review will add significantly to the decision-making process. We're looking at the purchaser-provider split. We're looking at standardised care assessment frameworks. We're looking at individual budgeting, and we're looking at quality standards and the regulatory structures. So there's been some structural reform as well to date. The HSE Governance Bill was published in July of 2012, in line with the target of the government, and it provides for a directorate to be the new governing body in place of the HSE and the creation of new effective management structures. Each directorate management team will have a clear budget and a mandate to deliver sustained performance improvement underpinned by money following the patient. And then we will have the establishment of the Child and Family Support Agency. The work of my colleague Jim Breslin and Minister Francis Fitzgerald are to be commended as they deliver on target what was described in the programme for government. And then, of course, the creation of the purchaser-provider split, which will inform and help us deliver a better quality and a more cost-effective service. In relation to financial reform, we will be implementing the recommendations of the Ogden Review, and that report will be published by the Minister in due course, and he will outline, he's already committed to taking certain actions which are in hand, and the report on that progress will be made in the not-too-distant future. We're delivering and developing time-bound plans for implementing money following the patient, and we want to proceed to the introduction of programme-based budgeting and the provision of health service funding through the vote of the Department of Health in 2014. We need to do that process very carefully, and in the difficult economic times we're in, we want to ensure that we protect the interests of the frontline services. The reform of health agencies is a major programme of agency rationalisation ongoing within the health sector. Good progress has been achieved from 2008 to date. We've moved from 29 agencies in 2008 to 20 currently. There's significant pieces of legislation now being brought before the houses of the Oireachtas. We are using efficiencies we derive from the economies of scale and the elimination of duplication in areas such as procurement, recruitment, payroll and ICT, and I'd like to commend the work of the HSE in that area. And I know they will engage with the wider service providers in the voluntary sector to get more economies in future. The health sector is required to develop plans for shared services and external service delivery by the end of October of 2012. The opportunities to enable the reform programme to achieve the standardisation of processes, allowing greater transparency and accessibility, reduce duplication and the elimination of waste, and significant cost reductions in the medium term. Now, the next steps for reform, and in the coming months, and no definitive dates have been set by government for these, but I can tell you that my department is currently working with our Ministers of State developing a strategic framework for health reform. We are looking at a structured, staged approach to implementation. We plan significant structured engagement with all key stakeholders. We plan the establishment of robust governance and management arrangements for health reform, working with the HSE, and in particular, working with the Director General and the new directorates. The department will work very cohesively and very effectively with the HSE, and we will develop a detailed implementation plan with timelines and costings. So we're on the way to the reform programme. The work's already underway, and there are key milestones ahead.